Dr. George Kramer has over 30 years of experience in sports and musculoskeletal pain medicine in Minneapolis and the western suburbs. He is board certified in physical medicine and rehabilitation and pain medicine. He is also one of the few doctors in the United States certified in prolotherapy by the American Association of Orthopedic Medicine, and is an expert and educator in prolozone treatments. Dr. Kramer graduated from the University of Minnesota Medical School and did his residency at the Mayo Clinic. He is a founding member of the American Academy of Ozone Therapy and founded the Sports Medicine Center, Low Back Clinic, and acupuncture program at Park Nicollet Clinic in the 1990s. Dr. Kramer is an adjunct associate professor in physical medicine and rehabilitation at the University of Minnesota Medical School. Dr. George Kramer's unique approach blends conventional medicine and rehabilitation techniques with advanced complementary therapies to provide innovative pain relief solutions for his patients, helping them get back to the active life they love. Dr. Kramer's patients travel from far distances and even internationally for the care he provides. He applies a broad set of medical treatments and procedures that have proven very effective for even the most difficult cases. As a result, many people can avoid surgery and the unpleasant side effects of prescription medications. Please welcome to the summit, Dr. George Kramer. So I am here with one of my favorite go-to people in natural health, Dr. George Kramer. Thank you for being with us today at the summit.
Thank you for asking me. I'm honored to be here with as part of the program.
Absolutely. Dr. Kramer has been a vital healing piece of the puzzle in my own, or our own family, which you'll get to hear about in just a little bit. And he is a medical doctor who specializes in natural pain relief. So tell us just a little bit about your background and how you got into this field.
Okay. I'm an MD. I went to the University of Minnesota Medical School, and I did my residency in physical medicine and rehabilitation at the Mayo Clinic, focusing on sports medicine and musculoskeletal medicine. And then I started the sports medicine clinic at Park Nicollet. This is a long time ago, and their back clinic there. And I was also certified in acupuncture. So before there were many doctors doing acupuncture, or even believing in acupuncture, I was doing that for a time. But I found that the drugs and surgery just weren't helping people get better. It may temporarily help pain, but I wanted to focus on things that could stimulate healing. So I got into nutritional therapies and things like that, but also prolotherapy and prolozone is the injection therapy I do mostly now, and it stimulates the body to heal, to build new connective tissue, to strengthen joints, strengthen backs and necks, so we can actually help cure people's illnesses instead of just stopping their pain or covering up their pain.
Yes, and it's been such a vital piece of the puzzle for many of our patients. So as you guys know, I am a chiropractor, and many of our patients come to us in pain. Not all of them do, but you know, pain and inflammation go hand in hand, as this summit is all about. And there are multiple different ways that we go about pain prevention and pain reversal. Nutrition, we've talked about that, detoxification, but there definitely are cases of people that they need a Dr. Kramer in their life because despite some of the best efforts made, which we would still say, you know, eat a clean diet and support your detox pathways. Those are things that are just fundamental in today's living. We have to be doing those things. However, if pain is not resolving, and I've seen this many times over the course of my clinical experience, we have got to have and reach a point where we send out to a trusted source that's not just covering up the issue. And that's what separates you from literally, we were talking about this before the summit, that Dr. Kramer has patients that come from the 5-state area and even Canada to see him because he's literally one of the only practitioners in the state that does this, prolozone and ozone injections. So what was really interesting for me to learn about Dr. Kramer was about ozone. And you mentioned that the injections actually stimulate the body's healing mechanism. So maybe if you could just answer that question a bit further. Tell us about ozone.
Yeah. Well, first of all, I wanted to say that when I see someone, I do a holistic evaluation because all these things tend to affect someone's healing ability. So I don't want to treat someone if they're not going to heal, and they need to be working on their inflammation and their diet and what are some barriers to healing. Hormones, emotional or spiritual health are all factors that affect our healing. So I will look at that, and then ozone, to answer your question. Ozone has 3 oxygen atoms. It's the smell that you hear after a rainstorm, or the smell you smell after a rainstorm that's fresh, that's ozone in the air. And it's 3 oxygen atoms, and how we use it in medicine is to hyperoxygenate deep tissue to increase blood flow and healing. We don't heal without oxygen. We don't live without oxygen, but our wounds won't heal if we don't have good blood flow. And prolozone brings oxygen to that area along with nutrients to heal the deep tissue and stimulate connective tissue growth factors, stem cells, and fibroblasts, and then balance the inflammation, decrease the inflammation in the area so it decreases pain.
So it truly is, it's a healing modality.
Correct.
Yes, it is a pain relief modality, but even beyond that, I think what sets ozone apart from its counterpart, or not even in the same ballpark, cortisone, right, is that it is a healing modality. And for our faith-based patients in the crowd, Dr. Kramer offers to pray for you and with you before any injection. So that is, yeah, go ahead.
I'm the helper, not the healer. God's the healer.
Yeah, which is something that, I mean, anytime we're getting any injection into our body, it's like it just offers that added comfort to know that Dr. Kramer is he's submitted as a vessel and truly as a colleague that's referring to you on a consistent basis, knowing that our patients are going to get that level of care and comfort, it says a lot about your practice at large. So thank you for doing that. Mm-hmm. So we've talked about ozone being a healing agent, very compatible with the body. Let's talk about some actual conditions within the body that our audience may connect with. In practice, I can say conditions that I have sent Dr. Kramer's way include people that struggle with hip pain. So we see, we would kind of call it chronic hip issues, chronic shoulder issues, and you can elaborate more on these, knee issues, and even carpal tunnel or elbow things. So yeah, maybe tell us what are some of the most common conditions you've seen.
Well, we'll hear about Rob's.
We do get to hear about Rob's, yes, my husband. Like
disc herniations in the low back, the neck, degenerative disc disease, kind of wear and tear, meniscal injuries like knee injuries, cartilage damage, degenerative arthritis in the knee, people who don't want to have surgery, or they've had surgery and they still have some pain. They don't want to have a knee replacement, or they don't want to have a scope. People with rotator cuff tears, rotator cuff injuries, oftentimes do very well with prolozone. It's called prolozone because it uses ozone, but we're proliferating connective tissue. We're trying to build new tissue to thicken those. Say if you've got a tear in a tendon, to kind of fill in the gaps with new tissue.
Awesome.
So migraine headaches, whiplash, pretty much any injured joint or degenerative joint, TMJ.
Yes.
That grinding and popping can be very helpful for that. We talked about, but even foot pain, plantar fasciitis, kind of head to toe, really, it can
as our chart,
be helpful. Yes.
Yes, as our chart illuminates. So as I mentioned, Dr. Kramer has been just an instrumental piece of our healing journey. And this is my husband, Rob, and he has dealt with a low back injury that stems back to many years ago, and we've been maintaining it through chiropractic care and other things. But we reached a point this last year where the pain was excruciating despite all of our conventional interventions, and so we called Dr. Kramer. And Dr. Kramer, tell us what you found in Rob's spine.
Yeah. Well, Rob, he was hurting when I saw him. He could hardly straighten up. But his MRI, I want to show you, showed a large disc herniation at L5S1 level. Now, discs are like jelly donuts. They can crack, but if they crack enough, the jelly comes out and can bump a nerve. And his disc is quite large, and it was hitting a nerve and giving him leg pain. So I'll let Rob tell what he was going through and everything we did and how he is now.
Yeah, sounds good. It's fun to see the pictures too, because I don't really know what any of that means, but I know I was in a lot of pain. So, as Susie mentioned, I injured my back in 2003, blew out my back in 2008, and mainly because of overactivity. And kind of proceeded every year to blow out my back or throw out my back or whatever the medical term is. I think it's cracking the disc, as Dr. Kramer says. And I think it was actually in 2017 that I herniated my disc, so 2 years ago now.
To the point of needing a surgery to remedy it, likely.
Yeah. So I went in for an MRI, and basically it was fully herniated, needed surgery, no other option, and that's when Susie referred me, or Dr. Susie referred me to George, and we did the injections the first day, and there was no question. But before that, I couldn't walk. I had enough pain where I just about threw up multiple times a day, and as a dad of 3 little kids, 2 at the time, I couldn't get up off the couch, and so it was to a level that was, as Susie can attest, unbearable. And so when I went into Dr. Kramer, he explained all of it, said I'd be a perfect candidate for the injections, and after the first round, I went from probably level 10 pain to level 2 or 3. To the point, and I know it's not supposed to happen right away, but it did.
Sometimes it does.
And it was to a level that I could stand up and I could have a conversation with people. Couldn't exactly throw my kids, but I could be a human being again. And I asked him if I could come in a week later. And he said yes, and so I did. And at that point, I went from level 3 to 0.
He wanted, because he was going to Disney World.
Yeah. So we had a trip planned to Florida in multiple places, going from place to place. And one of them was Disney World, and I am the pack mule of our family. And so usually I'm carrying 2 or 3 bags, 1 or 2 kids, and pushing stuff. And
a car seat.
And I couldn't stand up. And so we literally made that trip happen, and it was awesome. And so
I think you had the injection on like a
Tuesday, and we left on Friday, I think.
Well, for those of you that really related with this conversation, Dr. Kramer is extending a special to all roundtable participants. His generous offer for new patients is actually $100 off of your initial visit to their clinic, which is in Minnetonka.
Correct.
Advanced Medicine Alternatives. So Dr. Kramer, I just want to thank you again so much for your time, your talent, your heart, and all that you pour into your patients, like my hubby here. And we are just honored to have you here on the round table with us.
Yeah, thank you for asking me. I'm honored to be here.
Absolutely. Thank you.